Today on Beyond the Image, I'm sitting down with Vanja and Brittney from the Enterprise Imaging Division of Optum and Josh Staples, SDMI IT Director. We're going to learn what happens to your images after you leave the SDMI facility. Thanks for joining me, guys.
Thanks for having us.
It's great to be here.
So let's start with just some simple introductions. Tell me about your positions within the organization and kind of what got you into enterprise imaging.
I'm the Associate Director of our Customer Success Program, and one thing that I'm extremely passionate about is how do we always impact patient care on a daily basis and really taking it to the cloud to the next level for it to have more of ease, security, and also making sure that your patients are being taken care of in a timely manner.
I'm a Senior Director of Product at Optum, and I look after radiology solutions, which are daily used by SDMI and the radiologist in the organization.
And I'm the IT Director. We keep everything running within the facilities and make sure everything's good for the patients.
So patients are really familiar with the front end part of the process, right? You come in, you get on the table, you get your scan, and then you leave, and then what? So back in the old days, we had films similar to cameras, right, that actually printed out, and that's what radiologists would look at. But there's been such a huge technology shift in radiology over the last several years. Talk me through what that shift has been and what's happening to those images now.
Over the years, obviously technology changes, and rather than printing film, like you said previously, we're really focusing on digitally transmitting images for the benefit of the users being able to access them in a different ways and much faster than before, where they had to wait for images to be printed, presented to the radiologist. Now those images are readily available to radiologists no matter where they're located. Also helps us track those images and index those images. And the software itself is designed to make radiologists be able to look at those images in a various specific ways, be able to turn them the way they need it to be able to scroll at the speeds that they need to be to actually understand what is happening with the patient and be able to create a diagnosis, which ultimately leads to a treatment plan for that patient.
What changes have you seen in the technology in your career?
Well, obviously technology plays a big part in all of our lives, right? And as we get older, the technology improves, but it's really one of the interesting part is really everything comes now to accessibility and availability of the imaging data. So just being able to be at the various different locations, not having to be physically present in a specific place to access that data. Be able to leverage technology and the speed of technology to access images in a tiny manner, and therefore resulting in turnaround times, meaning the diagnoses are being produced much quicker than before. And an ability to actually track where that data is, to be able to store that data and readily access it when it's necessary for the future scans or the future comparisons. So technology does play a great factor in making everything work so much faster. And really the plan or the goal is always to have this diagnosis presented to the patient as quickly as possible. So leveraging technology enables us to do that. And with the tools built in, I would almost say that radiologists have more opportunities and capabilities to actually be correct the first time.
So we refer to that system as PACS, correct? Tell me, what does PACS stand for? What does that mean? What is a PACS system?
A PACS system is a picture archiving and communication system. That's what the acronym stands for. It's essentially an application that allows the radiologist to access, view, and manipulate the patient images in a timely manner, as Vanja was talking about, and really help with patient diagnoses and making sure that everything gets done in the most efficient way possible.
Images get presented to the radiologist, and now we've got these great high-res images where, everything's digital, it's coming over to them quickly. What happens after that?
Once the radiologist reads the images and makes the diagnosis, are you talking kind of what happens after that point? So after the report has been put out?
Yep, so report's been put out. Now how are we storing these images? What are we doing with these images? Who else has access to them?
So right now we're actually working with Optum, and we are storing the images very securely in the cloud for long-time storage for those images to be retrieved whenever they need to be. We have the abilities for the patients to view them on the patient portal, as well as referring physicians when needed. They can as well download them from the portal or share them to any specialists or any further care providers they need.
So Brittney, you talked about the patient experience being really important to you as part of your position. How does all of this ultimately impact that patient experience, and why should patients be concerned about the types of PACS systems and the types of images that are being presented to the doctors?
I think one thing that we've really done a great job with our technology is being able to have it in the cloud and have it easy accessible. And as a patient, right, you go through, you come and get scanned, you're waiting for your diagnosis, and then you know you're going to get called from your provider, right? And you want to be able to see your images, right? And you want to take them to your providers, or you might want to show your aunt or someone else to get a second opinion, right? We hear this all the time. But with our solution, we're able to actually look at the images digitally. And I always like to try to think of it's like Google Photos, right? Everyone's familiar with Google Photos. They go in, they see their images, they can share it to like their best friend, their family member. Well, we have that exact same technology, but for images where it's super safe, super secure, and then they can access it and send it to their providers, look at it themselves, or also go for a second opinion.
Talk to me about what is a day in your life on the application side.
I have a team of customer success managers, and something when we created this program is we wanted to look at it a little bit differently, because there's traditional, which you guys currently have, right? You know, we talked about PACS. So PACS is the on-prem, but we're taking the leap to go to the cloud, and we want to get that security and that ease of access for images. But we knew it was important to actually have a team of just kind of a little bit more of a true account management touch, where we're actually partnering with partners just like SDMI to get feedback as we're building out the technology in the cloud. And everything that we do, we think about how does it impact patient care. And so we have a direct link with our engineering product with Vanja. Services support organization. It's really a true partnership, and we've actually been doing this for over 22 years now.
Mm-hmm.
So why is that partnership important, and what aspects of SDMI are you looking at? Who are you talking to? What's kind of the feedback that you're getting?
You know what's amazing about our partnership is you're very focused on cutting technology, like cutting edge technology. What I mean by that is, you know, what's new, what's safe, secure, and also what's going to improve overall patient care. And so there's a lot of times when we're coming out with new features that we're building out in the cloud, we actually partner with them for feedback to see how would it impact the day in the life of the radiologist all the way down to the patients.
Can you give me an example of some of those features?
There's been a lot of features that we are looking at that we currently use with your normal radiology PACS, and how do we bring it, but how do we improve that?
Some of the other ones maybe, like, you know, everything is always focused around optimization and efficiency of the radiologist, right? That is, you know, the goal is to provide the diagnosis for the patient as quickly as possible so they can go on with the treatment. So we're focusing on leveraging tools and features that will help prioritize, like maybe focus the radiologist to the maybe more urgent exams, or help them organize their daily workload so they can not have to switch constantly between different types of studies, or they can make them a little bit more efficient. So every time we release a new feature, we do work with Josh and the team to implement it, and when we follow up and see how it works with the radiologist, right? Is it actually helping, and does it actually make them faster? Does it actually make them more easier to view the images and create the reports? And therefore, again, everything comes down to the patient care, right? The faster, the better, the quicker this is done, hopefully the happier outcomes will be for our patients.
Josh, give us some insight on what the radiologist workflow looks like, right? Back in the day, I remember as a kid, I would go get an x-ray and they take you down to the development room and you get this kind of cool experience of getting to see how everything worked. But now with everything being digital, patients get off the table, they walk out the door, and they don't really get to see what the radiologist is doing. Can you give us a better idea of kind of what their day is like from the PACS side of things?
Once the patient is imaged and is hopefully on their way, the imaging goes to the PACS system, and the radiologist then uses some of the tools that Vanja was just mentioning with the work list that helps prioritize what needs to be read, when and how quickly. So the radiologist will use that work list to select the next study that they need to read. It will launch into the PACS image viewer. From there, they can manipulate the images in any way that they need to, change contrast, brighten, darken, rotate. For some images, they can create a new plane of view within the what was captured by the actual modalities, and then from there, they'll dictate their assessment of the study, of the exam, and sign it off, and from there the report goes to the referring providers and is then available for the patients as well.
So we talked a little bit about patient portal, referring provider portal, them being able to view those images. Are the images that they are viewing a lower resolution or a less quality image than what the radiologists are seeing?
They are not. No, it's the same resolution or the same quality image. The real difference comes into the hardware that the images are being viewed on. So the radiologists have medical displays that are very high resolution to make the best diagnosis possible, whereas most of us at home don't really have 32 megapixel monitors to review these images.
So I think one of the easiest things to use as an example is, a woman coming in for an OB ultrasound. Back in the day, right, it used to spit out images on little cases of paper, and now you can kind of log in and get your full digital catalog of, your soon-to-be baby. When they're looking at those images, what are the capabilities that the user has as the patient with those images? Can I download them? Can I print them? I know you mentioned you can share them, but you also talked about some of the manipulations that the doctors have. Are those things that the patient has access to as well?
Within the image viewers on the portal, and that we can provide to the patient that way, they have the ability to manipulate the images the exact same way that the radiologists do. It's not the exact same system that the radiologists have, but it is effectively the same tool set that the patients would have access to.
How do you see providers using digital images now for collaboration?
Currently, right now, what we've noticed is they'll go ahead with the technology. Once the scan is done, then it is sent over to the provider, and then from there, they're actually using our viewer, we've noticed, or then they will go ahead and actually import it into their PACS system, and then start using collaborating on what the next steps are in treatment.
What do you guys think the future is of PACS?
As much as our lives, we're kind of moving to the mobile devices, expect to have access anywhere we are, right? And we're kind of the whole world is moving to really be flexible where we access the data. And really we are looking at the technology being able to replicate that for the medical industry, right? Obviously for the imaging, the first step we talked about, going to the cloud, having that data be centrally available and then accessible from any different location in a timely manner is a big step, meaning that you can now start leveraging accessibility from different places, right? Have specialists that you may not have locally be accessible remotely, and they'll be able to access that data in real time and be able to, again, everything going towards the patient care, be able to provide those diagnoses in a quickly manner. The radiologist can be on call, it can be in different locations, just being able to have that flexibility. So I think, going forward, we're obviously going to see the greater use of that technology and just the flexibility and the speed in which the data is transmitted, communicated, and obviously the results that are coming back to our patients.
Obviously, radiology is the obvious client for you guys. What are some other clients that you collaborate with that maybe would not be such an obvious direct tie?
Well, we're working, obviously radiology is just one of the areas that we do. We service also cardiology, which is the other part of the radiology, focusing on the heart, right? So really the medical imaging as a whole, we're focusing on that. And, there's a term enterprise imaging that is coming to the forefront over the last 10 or so years, when it was really focusing on all the imaging being done at the healthcare organizations. It could be cardiology, pathology, other ologies of dentistry and stuff. So like, they all produce imaging, and when you really look at it from the organizational point of view, image is an image. Yes, they serve different areas of the organization, but storing, managing, distributing, they all follow the similar process. And so the industry is focusing on the imaging as a whole for the healthcare.
So not just radiology has a PAC system. A PAC system could be in your doctor's office and you wouldn't even know that that's there.
Correct.
Okay.
There's many different viewers, or as Josh alluded to, image viewing that's being used by many physicians throughout the day, and they all have different goals or different things that they achieve with those.
So you're in and out of healthcare facilities all day. You kind of see the gamut of them, and you kind of see different patient experiences, across the different partners that you have. What advice would you give to patients that are trying to navigate a healthcare journey?
I really think it's all about accessibility, right? And just being able to find that partner and that provider and the person that's going to be helping you with your diagnosis, and making sure that you have all the relevant information at your fingertips. And that's from the report to your treatment plan to your next appointment that you're going through, to be able to see your images. I think it's really important. Is the key is accessibility, and that it's safe and secure.
So I see it really in two ways. I mean, we're all like creatures of habit, right? Mm-hmm. And what is important when you go to see a doctor, I want to make sure that there is a good technology, that somebody's going to look at my images. I want to make sure that I get results in a timely manner. And what we do is, in partnership with our customers, such as SDMI, we try to provide the technology as best so they can focus on the clinical needs and the clinical aspects of the patients, and have that technology to be able to communicate, to be able to have that data available as quickly as possible. I mean, we all want it quickly, right? And so really that is the goal, to have the technology and the tool set that is required to be able to improve those turnaround times and provide the information that the patients need back very quickly.
What advice would you give patients, Josh?
Patience,
Yep.
Being part of SDMI here, we do have a very large patient population, a very large referring population. We leverage the tools from our partners like Optum to, provide the best care possible for each and every patient. But at the same time, it is a high volume facility that we run here. We do pride ourselves on having a very good turnaround time, as Vanja was mentioning, but at the same time, as much as a patient wants to have that information as soon as possible, there are humans on the other end that do have limitations as well. So as much as we are leveraging technology to help make everybody more efficient in from the radiologist to the technologist to front desk to even scheduling, right? If we go all the way back through the entire journey of the patient within SDMI, there are people at each step of the way. So some patience is needed, even though we do understand that it is the patient's health and well-being that ultimately will be impacted.
Anything else that you want to make sure that patients understand about PACS and what's happening to their images after they leave the facility?
Probably the most important thing is know that images are always maintained in a safe manner. They're readily accessible. Really, every exam that a patient ever has is an important one, and even if you may not think they are related, specifically if you are tracking a disease. Having previous exam as a comparable is a very, very big part of the radiologist reading workflow. They constantly look at how the disease or whatever they're looking at may change over a period of time, and so knowing that the images are safely stored and available when needed for any future comparison is important to note, and again, that the patient can always access their previous exam should they need it for any of the follow-ups. So that would be one of the things that I would like to highlight.
So let's talk about that. If patients move into a new area, and it doesn't just have to be Las Vegas and SDMI, it could be anywhere, and you've had images done somewhere else, how does PACS respond to getting those images? How do we get them in from the other side if they're coming from the outside world?
I'll take the first part of this, and then I'll kind of pass it off to Optum here. We do work very closely with many different organizations outside of SDMI, outside of Las Vegas even, to receive priors or anything that needs to be compared to give the best care possible to each and every patient. We have many different methods of ingesting those other exams from wherever else they may have been performed. We normally call that image sharing to be able to have another facility send us images, or vice versa, to where if a patient does need to go out of town for additional care or has moved, like you mentioned, we have the ability to send their history to their new location to help facilitate anything that needs to be done.
I think what's key is advancements in technology, right? So, before when you were a patient, right? And let's say you moved, or even if you're on vacation, right? And you broke your arm, and so you'd have to get a disc, or there'd be the carrier that'd go and drive around these discs, right? And then you're knowing it's kind of delaying the patient care, right? To go ahead, because they need to see the priors, like Vanja said, it's so important. They're all connected, but now with advancements of technology, like Josh was saying, we can do imaging share where it's a digital transmission between providers to hospitals, health systems, to outpatient radiology clinics. It's an easy way to transfer the images, and not only just the images, but also the reports as well. Mm-hmm. And then it gets all filed together with a PACS solution to create the whole holistic view of the patient.
So if SDMI is on Optum's PACS solution and somebody out of state is on some other PACS solution, does that pose a problem, or does all PACS kind of play nice together?
Yeah.
Go. No, it's a great question. So, over the years, there's been a lot of standardization as far as the communication protocols between different systems that manipulate or store imaging. So, in a particular question, if another PACS system is used, actually the protocol that is used to transfer images between the two systems is standardized. So, whatever it is acquired in our PACS system or in another PACS system, when those images are sent between them, they will actually play nice. It will store just as if they are originating from the local facility versus somewhere remote. So standardization plays a big part, and it's really the very important aspect of being able to actually create this exchange network or a collaborative network with other partners, because we all speak the same language.
So patients don't need to worry about figuring out what PACS system their radiology facility is using or their doctor is using. They really just need those key terms of image share and, how can I get my images to wherever I need them to go.
Correct. Again, the technologies really has made that much easier. Before you're supposed to go to CD, and if the CD doesn't work, you got to go back. And now it's just a little more, it's actually, I would almost say it's almost like managed by the organization. So SDMI will transfer those images. We'll be able to audit and track that data so it doesn't get lost. We all know the importance about, patient information. So by having the technology manage that, it's more secure and it's more readily available.
Talk to me about onboarding a new client. What is that process?
That's definitely in the customer success wheelhouse. So what we do is as soon as it is onboarded, our first step we want to do is we actually want to understand the goals, right? And what's the goals of the institution? So operational goals, the financial goals, adoption, and how does this all tie back to patient care? So we actually do extensive goal setting interviews to map out strategy, and then we go through and work them side by side through implementation, making sure everything is configured correctly, doing extensive testing, and then rolling it out into production, and then following up and, checking in always, right? To make sure that, hey, how's your turnaround times, right? Is there anything that we need to do in an advancement within the technology? Getting that feedback, I think, is really important. And then that's where a customer success manager really plays an important role, because they're there at the point of, as soon as we start with that business and onboard, we want to be lockstep through all of our development life cycles.
What can a patient do, or what kind of questions could a patient ask their referring physician or their radiology provider to make sure that they are getting the best patient experience possible from the technology standpoint?
From a patient perspective, right? A lot of times it's they'll want to know, is it available? Am I going to be able to get to see the images? Am I going to be, how quickly, how long do I have to wait? Are you connected with other providers? Or I need to go send this out because I've been referred by a physician. Will you be taking care of that? I don't hear, at least maybe Josh, you can talk about it. I'm not really sure that they're asking about specifically, what type of modalities, what type of systems you have. I think patients are more focused on, I'm here for the reason and there is an outcome of this, right? I need to understand how quickly I'm going to get my results. Are you going to communicate those results to my provider? Those are the type of questions that I believe are more important to the patients, right? And that goes back to what we talked about, ability to send those images to the providers, the referring physician, be able to provide them access to the viewer and be able to download those images and put them so on. So this is where the technology enables that for organizations such as SDMI to be connected into the network and make it easier for patients to get the care that they need.
Yeah, I mean, it's kind of a hard question to answer, as I think we alluded to, but ultimately it comes down to ensuring that the patient is able to have full access to their imaging, full access to whatever reports or anything that they need to have, as well as ensuring that everybody's using modern technology. We started off talking about films. We as SDMI cut out films a few years ago. At this point, CDs have started to become more of a legacy technology, and having physical media, as you mentioned, is not always secure. If you leave it out somewhere, anybody can pick that up and put it into a system. So at the end of the day, the most efficient and the safest way to move imaging is digitally now, to ensure that nothing's getting lost, nothing's getting missed. So maybe questions that the patient can ask their providers is, are you able to do this without a CD? Are you able to do this without, or are you able to do this securely, kind of thing? So I think that's going to be the best way.
What kind of adoption have you seen industry-wide of this shift away from physical media and into the digital era?
I think, it started off slow, right? Because everyone with technology, and we talked about, right, we're all creatures of habits, where it was like, do we trust this? What's the cloud, right? And it's really taking the time to understand how it's way more secure. With how we're transmitting images back and forth. And now we see everyone is like, yes, I want everything in the cloud. It's way more secure. It's going to protect my patient information. It's going to be easily accessible now, and it's really going to improve the overall patient outcome.
Any other last tidbits that you would like to make sure that patients know or that you'd like to share about enterprise imaging?
From a product perspective, obviously, I'd like to say that we work very closely with radiologists, our primary users of our system. We work on developing new tools and new features to make their work easier, to make sure that they can do the things that are necessary to best diagnose and report on patient imaging. The technology changes, and with the technology changes, the new features, new capabilities are constantly available, right? And so we work really, really hard to build those and deliver those as quickly as possible, in an effort or in a goal to make radiologists' jobs easier, and by connection to the patient and being able to provide faster reporting, more timely decisions in their treatments.
Yeah, and then from a customer success perspective, I think we're really focused holistically. So as soon as your patient enters the door, what is their experience and how can we improve it, right? Improve it. So it's from people at this, like you started saying, right? The staff that's checking you in, to utilizing our technology and praying for the advancements of how does the radiologist, like Vanja was saying, interact right with our solutions, the technologist, and then how do we get it to the providers? We're constantly looking at that holistic journey with the patient, and then how do we bring it back into our technology?
So taking it more on the SDMI side of things, we're focused more on radiology, right? Obviously, we're outpatient radiology, whereas they have to, as Vanja was saying earlier, have to cover all of the ologies, as enterprise imaging is much larger than just radiology. We're doing what we can to keep up with the technology through our partnerships, and provide the best experience for not only the patients, but our internal users as well, the radiologists, the technologists, everybody that uses the systems and the technology that we have. We really take it upon ourselves to try to keep up with the changing landscape in technology, which is sometimes difficult with the advancements that are happening these days, but we do our best.
Thank you all for joining me today. I appreciate your time.